Well, let's get started. We got about 110 people on the call today or registered, so that's great to see. So I want to welcome everybody to our second webinar in our June series, collaboration with the Regulations Compliance Committee. As I mentioned last week, this is something a little different for the CA workshop, and we're really excited to bring you a little extra bit of content to kick off the operating season. Especially for this particular topic, given that it was highly requested to the workshop. So I'm here with David Orr, my fellow committee co-chair, and the Senior Specialist of Enforcement with Credit Valley Conservation. I'm Tori Fisher. I'm also from Credit Valley Conservation, our administrator for Conservation Parks. So mine will be the voice you hear moderating this webinar, and we have all our workshop planning committee with us on the call today. So big thanks to everybody here. Give a wave. Yeah, it's a lot of work that goes into these things, so they're very much appreciated. First off, I would like to turn our attention now to Brenna Bartley, committee member and education manager with Halton Conservation, to acknowledge the Indigenous treaty lands on which we gather today. I'll share my screen.
Thank you so much, Tori. Okay, so Tori's going to share with us a map from nativeland.ca, which is an Indigenous-led map. It shows you the treaty territory, and I'd encourage you, if you haven't had a chance to visit that website, this is a great resource where you can see both treaty and traditional territories. So, as we gather today virtually across what is now known as Canada, we first want to turn our minds to acknowledging and thanking the many Indigenous nations on whose traditional and treaty territory we live and work. We acknowledge that our special guests from British Columbia are presenting from the unceded territory of the Okanagan Syilx people, and we encourage you to look beyond government resources for more information on traditional and treaty relationships specific to your area. As a collective, we recognize and deeply appreciate the relationship, past and present, that Indigenous nations have with the lands and waters. We acknowledge and honor that Indigenous practices of land stewardship have created the clean waters and healthy forests, meadows, and wetlands that benefit and enrich the lives of all Canadians. In the spirit of the Dish with One Spoon Treaty, under which many of our lands in Ontario operate, we recognize that our own responsibility to protect and steward the environment for future generations. We also recognize and affirm our responsibility to support the work of Indigenous communities and uphold the 94 calls to action of the Truth and Reconciliation Commission through our work. Together, we stand in solidarity against systemic racism in our communities, homes, and workplaces. Niawe, miigwech, tiawik, marci, limanept. Thanks, Tori.
Thank you very much, Brenna. Okay, I'm going to share a few housekeeping items now. I guess I could have just kept my slide open. So public chat feature is available in this webinar, so please use it for Q&A and general conversation if you wish. For the Q&A portion, our speakers will be answering a few questions at the end of each presentation, and again at the end of the webinar, time permitting. So please type your questions in the chat feature, or we'll use the raise hand feature when Q&A is announced to be opened. And please, if you can, address questions to specific speakers to help us facilitate. Okay, so today we are exploring the complex issue of homelessness and encampments on CA lands, building on last week's intentions to develop a deeper understanding of the systemic issues resulting in persons experiencing homelessness, and what we can do to better facilitate and understand those circumstances. So this week we're going to hear 3 case studies. 3, yes. We had an exciting new addition to the lineup. So Park Services from the Regional District of Central Okanagan and BC are here. Hi, Matt and Wayne. Thanks for joining us from across the country. We're also going to hear from the Hamilton Police Services Social Navigator Program. Our guest, Sandra Kurdziel, is going to walk us through this cooperative program intended to address health and social issues for vulnerable individuals. And she will highlight a specific, in this case, success story from Hamilton Region Conservation Authority's Confederation Beach Park. Our third case study takes us over to the City of Peterborough's Social Services Division, and Bill Smith is going to walk us through their regional landscape as it pertains to homelessness and speak to the Beavermead Campground Project, which was a collaborative effort between Otonabee Region Conservation Authority and the city to provide temporary living space for persons experiencing homelessness. Finally, we're going to turn it over to Angela McKenna from Capstone Development and Training to hear about communication tactics and de-escalation techniques with scenario-based guided learning. So quite the lineup today. Let's get things started. I'd like to hand things over to Sandra Kurdziel now, who is the Social Navigator Program Coordinator with Hamilton Police Service.
Hi, thank you, Tori, for the introduction. I just want to make sure you can hear me.
I can hear you.
Perfect. Okay, I'm going to open up my presentation and let's see. Can you see that okay?
Looks good.
Perfect. All right, so I'm going to provide a brief overview of the Social Navigator program and talk about some of the challenges and perspectives of homeless individuals. So the Social Navigator program is a partnership between the Hamilton Police and EMS. Our team is made up of paramedics, officers, and myself, the program coordinator. And our mandate is to connect and support individuals through a referral process by engaging all social and healthcare agencies in the City of Hamilton. So really what we do is we refer clients to services based on their needs. So we'll refer to shelters, housing programs, detox and treatment centers, doctor appointments, connection to mental health supports, employment supports, income supports. Really, depending on what the client needs, we will try to make that referral or connection happen. We will even do simple things as making sure that we follow up and help get food, clothing, ID, and so we offer an urgent social response. We help to advocate for services because many of our clients have complex needs and sometimes have burnt a lot of bridges along the way. We assist clients through the court process. Another big thing we do is transport clients to appointments, provide case management, and coordinate care for our individuals. So some of the challenges that people might not be aware of or often bring up is for our individuals and complex clients is they often struggle with mental health and addiction, and many times they struggle with both at the same time. So getting the right care is often difficult, especially when they're homeless and focused on survival, right? Where are they going to eat? Where are they going to sleep? What are they going to eat? And so attending appointments is not their first priority when they're focused on survival, but often what we find is if we can offer the right reminders and supports, people will attend those appointments. They just struggle to remember the dates and times. And another big barrier for our clients is transportation. We expect people to have the money to catch a bus and manage the timetable and make it on time, and that's often a big barrier for clients. So we know that if we can show up and offer a ride, we can get people where they need to be to get the right help and supports. Another big barrier for clients is there's many wait lists for services in our community. So we in Hamilton are very lucky. We have a lot of services and programs that can be offered, but we also have a lot of individuals who require those supports and services. So wait lists can be a bit lengthy. So when we first started our program, we were just hoping to do simple referrals, but we found that that didn't work with our population because the wait lists and our clients often didn't have phones or a phone number to reach them at or an address. So we ended up starting to put our contact information. So when they hit the top of the wait list, that service provider would call us and then we could make the appropriate connections so they wouldn't lose out on that opportunity. And that has worked quite well with us. We often hear and get asked why people are living outside when we have shelters. People just tell us they should just stay there. We have places for them. And what people may not always know is there are barriers that clients experience within the shelter system. So some people may not know that people have to leave shelters during the day, so they have no space to stay. They're only allowed to be there during the night for sleeping purposes, and during the day they're expected to find a different place to stay. They're not allowed to bring a lot of items. So there's only small storage spaces, and often people will say that individuals steal from each other. They're in close proximity to other people. They're in dorm styles, which is difficult for some individuals. Many also share that they have bad experiences. They'll experience assaults, physical and sexual assaults, thefts, and people will prey on the vulnerable individuals. We also have limited options for couples, limited space for females. So even when individuals do want shelter space, sometimes they cannot get it. And then we don't have options for people with pets. So if the individual doesn't have a friend or family member that can take their pet, they cannot access the shelter system unless they part with that animal. So those are the standard challenges we see. And then with COVID hitting last year, we started to experience and see a different set of challenges, which made it very difficult for this population. So as I mentioned, with shelters, you often can't stay during the day. And so many people would go and access public spaces. But when the lockdown hit, all the public spaces were closed. So people couldn't access the mall, Tim Hortons, the library. They really lacked access to bathrooms, showers, laundry facilities. I don't think people realized how difficult it was for people to access washroom facilities because that community really does rely on those public spaces. I know when I was doing outreach within the first 1 or 2 months when the lockdown first hit, I couldn't believe how many people would ask me for tissues and toilet paper because they just had nowhere to go in the community, which was very, very sad. We also saw that there was a limited capacity in our drop-in centers. Our drop-in centers are a great service for our vulnerable community and those who are homeless, but when COVID hit, they said, oh, you can only have this many people in this space because of social distancing. So it really made it challenging for people to access those spaces and be able to stay in those spaces. We also saw that many service providers, whether it's mental health, addiction supports, or other providers, had to shift their care to virtual or by phone care, which is difficult for this population because they don't have access to a phone or they don't have access to a computer, so they're not able to get the supports that they need. Another example would be even income support. Typically, you can go into the office and speak to a worker, but when everything locked down, that was not an option. And so people had to call in. So they had to have the phone to make that phone call. And then often the workers would ask for documentation, and that documentation would need to be emailed. So again, you need the right resources in place to be able to follow those steps. And when you're homeless and you don't have that phone and computer, it becomes very difficult to get the basic needs that you need in those supports. The other big thing is we have a housing crisis. So there is a lack of affordable and safe housing. An average bachelor unit that we see is usually $850 plus hydro. People who are on Ontario disability will on average get $1,200 a month. So if you're paying $900 towards rent, that means you only have $300 left for food, bus, basic needs, and anything else. So that doesn't leave a lot of money. And then when we're looking at Ontario Works, just your basic welfare, it's on average, you get $550 a month, and an average shared accommodation is $450. That's usually a tiny room. No, you have to share a bathroom. Sometimes there's a common space. For $450 a month, it's really sad what people get because the conditions are not great and they're only left with $100 a month. And that again has to go towards food, phone, bus, basic needs, those basic things. People are not left with a lot of money, so it's difficult. The other thing to keep in mind, it's a very competitive market, right? So people are competing for one unit, and our clients often have poor credit and lack references, so they're often not at the top of the list. And then many times too, the other thing that people forget is, presentation. When someone's homeless, it's hard for them to shower or dress well. Clothing is very difficult to get while the COVID lockdown is happening. And so if someone shows up in tattered clothing, unfortunately, some landlords just don't give them the opportunity to get that unit because of the impression that they make. And then housing support programs are available in Hamilton, but again, like I mentioned, there are wait lists, so they're not easy to access for some individuals because they'll have to wait for those supports to be available. Just to give a perspective, in 2020, between the Social Navigator program and our city outreach team, we met 604 individuals sleeping rough or at an encampment. So those 604 unique individuals sleeping outside, we had 91 active sites across the city, and on average, we were dealing with 34 active sites a month. So I don't think people always understand how many homeless individuals we have in these types of environments of encampments and sleeping rough, because they sometimes are dispersed throughout the city, but it is a very common thing, especially with COVID and the lack of spaces for people. I'm just going to share a case study with you. So this is Ray's story, and Tori did mention a little bit of it, but this is Ray. Ray found himself homeless in April of 2020. He had been struggling after ending a long-term relationship. He had a suicide attempt and he was in recovery from addiction. He lost his housing, so he packed his bags and moved into Confederation Park because he had nowhere else to go. He shared with us that he was embarrassed, and he said, I was embarrassed. My pride stopped me from asking for help. Park staff would give me a hard time. They would give me 10 minutes to get my stuff together and get lost. People would look right through me, just past me. So these are some of the perspectives of the individuals who have to sleep outside. It's not an easy situation for them. He would say that at night, as things got colder, he got a tent, and then he found someone had come and cut his tarp. He had dog poop flung at his tent. There was no code of conduct amongst homeless individuals. They would just enter each other's site and people would try to steal from him. So it's not an easy situation trying to live outside. He also shared he had a phone, and so he was able to access a Facebook group because he was quite resourceful, and he went on a group called Recycling Kindness where he would ask for supplies, and he would get a big response of people coming, providing food and basic needs, which was wonderful to see. And he was one of the fortunate ones who met a really compassionate community member named Christy, who checked in on him, dropped off food, and even did laundry for him. And she had some connections within the housing services sector, and she had completed some housing forms because she knew of a property owner who may be able to help him get a unit. So then in fall of 2020, police were called as staff working at Confederation Park shared they had a male living under their park pavilion for several months. And at that point, a referral was made to our program. So in the fall of 2020, we had gone to Confederation Park, and I was personally there, and I remember looking under the pavilion. There was a male sitting there on his phone, and there were a few picnic tables brought closer together with a few blankets. So the site was very clean, there were minimal items, and he was so grateful to have us there and have a conversation. He shared his story with us, and he talked to us for over an hour. He shared he had bad experiences at the shelter. He felt it was safer outside. He said he was really struggling to get food and access to a washroom, and he found it getting harder at night as things were getting colder. He also shared that he was open to going into a hotel room, but at the time when we made that connection with him, they were not accepting single males because there were spaces within the male shelter system. So that was his only option, which he was not willing to accept. So with our interaction, we completed some housing paperwork. We connected him to a housing program in order to access a subsidy to help pay for rent if he were to get a unit. We also asked him to move away from the pavilion to be in a less visible space or less used space in the park. And so he would connect with us and stay in touch, but because he had a cell phone, which was very nice. And at some points he would share that the park staff were giving him a hard time and trying to get him to leave. We actually had a conversation with staff and explained he had nowhere to go, and leaving him at the site would allow us to follow up. And so staff were very supportive and understanding of this individual situation, and we were able to work with him. So in the next few weeks, we visited him quite often. We provided food, water, clothing, anything that he really needed around those supports. I like to share these pieces of his story because sometimes people don't realize how hard it is with the elements to live outside, especially as it got colder. So I remember in mid-November, Ray was provided with a winter coat, boots, snow pants, because it was starting to get cold and we had a coat drive, so we dropped those off for him. And then November 30th hit, and we had a really heavy rainfall. And he called us because his tent and tarp collapsed. Everything was soaked. His winter coat was soaked. He had no place to dry it except for the outside picnic table. And I remember going by and seeing his coat, and the coat was frozen because it was just too cold and the sun was not drying it out. And then right after that, a day or two after, December 1st, we had the heavy snowfall. So now the coat that he was trying to dry outside was covered in snow. His boot fell apart. This is actually a picture of his boot. He sent it to me because we provided the boot, and he said, Sandra, I was walking down to the bathroom and on my way back, the whole sole fell off. And so we're like, oh, this is terrible because now his socks are wet. So we're trying to get down there to replace his boots and give him a warm pair of socks. And then something great happened on December 3rd. He called us and he said he was offered a place to live and he can move in December 15th. And he was so happy because he had been outside for many months and it was just getting harder and harder with the snow and the rain and the cold. And so on December 8th, he also shared that on his 55th birthday, he had some friends that pulled some money together and got him an Airbnb until his unit was ready on the 15th. And so we were able to see by providing him those supports and making those referrals, he was able to get a unit. And Ray still remains housed in his new home and is doing very well. We still stay in touch with him and see and connect with him, which is great. And so I just want you to remember the key parts of Ray's story is that he shared he struggled with depression and was recovering from addiction. So there were some challenges there. He felt shelters were not safe and felt it was better to stay away and live outside than to have to live in shelter. He was respectful, clean, and wanting help. And by allowing him to remain in one place, we were able to provide wraparound supports and with the help of a community citizen, find him appropriate housing. So in these pictures, you can see at the top, that was his site when it was snowing. And then you can see him with the female, that's the community citizen who just had a kind heart and was helping him. And then December 15th, she and her friends, I think they were from a community church as well, furnished his entire unit. So on December 15th, he moved into a beautifully furnished unit, and those are pictures of his bedroom and living room. And I remember he was so overwhelmed and crying and just so grateful for the whole experience and the help he got. And like I said, he's still doing well and is housed. So just in closing, even if you are not an outreach or social worker, you can make a difference. Be kind to those you come across because these often are good people who have bad days and who are someone's father, mother, brother, aunt, cousin. And if they're presented with the right opportunities and supports, they can thrive in our communities. Thank you.
Thank you so much, Sandra. Wow, it would be a little emotional. I think this just really opens up possibilities for potential assistance for, vulnerable individuals on our properties and a bit of a perspective shift that I think is much needed. So we really appreciate your involvement and for sharing with us today, Ray's story and for the work that you do. We'd like to take, if there are any questions right now for Sandra, I don't see any in the chat, but if anyone would like to utilize the raise hand feature or offer a question for Sandra, we can take that now. Oh, Richard?
Yes, hi, Sandra. What a wonderful presentation. My background was in some of the Toronto parks, so I have a lot of experience with those kinds of issues that you've described. To what extent are you hearing about, and I may have missed it because I missed the very first part of the presentation, but to what extent are you hearing about the whole notion that a person's home is where they are, like, especially when you're homeless, your home is where you are, like where if you're encamped in a park or something like that, that's your home. And so this whole notion of park staff coming in under some whatever bylaw it is for their municipality or their organization and saying, well, you're not allowed to be here. To what extent are you hearing that? Because when I left Toronto, the medical profession was definitely weighing in on this and saying, listen, with the mental health issues that people have, it's very much incumbent on everyone to work together, as you noted, and say, look, we've got to work together. We've got to let the person be where they are until we can get them into a better situation, as opposed to this whole idea of kicking them out, which only puts them somewhere else, wherever that is. And they just keep doing this hunting around.
Yeah, so we definitely hear that, right? That the individuals have the right to choose where they're going to live, and that tent is their home in that moment, right? And so what we do is we really balance their needs, but also understanding the impact that they have on others and a community. So like for Ray's story, he was quite successful where he was, but he wasn't causing a lot of issues. He was very respectful in his environment. And so that's why we didn't push for him to go out. But we do have bylaws in place that don't allow people to stay in certain areas or private property. And so depending on the circumstances, police might have to step in and say, you have to go. But the City of Hamilton does have a protocol in place where it does allow certain individuals to stay in public green spaces as long as they follow some criteria for a certain period of time. But really, when we are responding, and because I'm part of the police service, we also take into account the impact they have on others, right? If they're not having a negative impact and they're just there to be, they're not a high priority for us to move along. But if, of course, there's lots of drug activity and fights and fires, and they're up against someone's fence and they're causing issues, then of course we'll have to respond a little bit differently. We might have to enforce moving them from a particular park or green space, but we're still going to offer them the supports if we're able to.
Thank you, Sandra. So I know we have a lot of speakers lined up today, so I want to keep things kind of moving along. And I want to thank you for that answer. I do, if there's any other questions for Sandra, please utilize the chat feature and we can answer those at the end of the webinar if need be. But thank you very much, Sandra, for your perspective and for sharing. All right, so next we have Bill Smith joining us. Bill is a client service worker with City of Peterborough Social Services, and I want to welcome Bill. Are you here with us?
I am here.
Hello.
How are you guys? I'm just going to pull up my presentation, hopefully.
Coming in loud and clear.
All right. Everybody can see that okay?
We can.
Thanks. So first I want to thank Orca for inviting me today. So I'm Bill Smith. I'm a homelessness outreach worker for the City of Peterborough and Social Services. And we're just going to talk a little bit about what we're doing in Peterborough around homelessness and the Beaver Meat Project. And I need to thank Sandra for that presentation. And that really could have been a mirror image of what's happening in Peterborough right now. So thanks for that. Okay, so we're going to start with what we're doing locally in Peterborough. And in Peterborough, we really strive to know every homeless individual by name and kind of understand their individual needs. And we do that by using the coordinated access system and the by name list. So the coordinated access system is a community strategy, and it helps to prevent homelessness and match individuals and families experiencing homelessness to housing and support resources. In Peterborough, we use the housing first approach, and we have a lot of agencies on board with this same approach. And together we assess people's housing needs and connect them to the supports that hopefully find and keep them housed. Housing First is a program, for those who don't know. It's really a systems approach, and it kind of recognizes housing as a basic human right and focuses on helping people experiencing homelessness obtain housing and maintain that stability. When we talk about assessments, one of the assessments that we use is called the SPDAT, and it's the Service Prioritization Decision Assistance Tool. And through that assessment, we talk about their history of housing, when they were last housed, what happened to that housing, their mental health, addiction, any risk factors, like are they actively involved in risky behaviors, any involvement with police or the legal system, their physical health, and then some demographics. So, if you're a senior or a youth, that will change basically your acuity or your risk and your level of needs. Once that assessment is done, we add people to the Peterborough by name priority list. And so that's like a real time, it's constantly being updated based on people that we run into in the community and all people experiencing homelessness. Oops, sorry. Hit my mouse. Sorry. So by name the by name list helps community partners know every person in Peterborough that is experiencing homelessness and prioritize them based on their needs. And that kind of helps us understand what type of intervention to use. So what this means is we work with our community partners and all of our community partners that have anything to do with homelessness and housing will pull from this priority list. So if we have a housing program that comes with a case manager and a rent subsidy and it's very intensive, then we can match that from the list based on some of the assessments that we've done to make sure we're matching the correct program with individual needs. So in some cases it might truly be financial and they just are looking for a rent subsidy. In other cases, it could be a tri-morbidity type situation where it's mental health, addiction, and maybe some physical health things going on. So they're going to need more supports. So the coordinated access system, it's not a program, it's kind of it's evidence-based. It came out of the US, and there are 13 communities in the United States right now that have virtually ended veterans and chronic homelessness in those states. So we are fully invested on this. And some of our stats in Peterborough are that on average, there's been 260 people per month experiencing homelessness in Peterborough City and County. 3% of those have been sleeping outside or places that are not fit for human habitation. 43% of them have been homeless for 6 months or more, so they would be considered chronically homeless. The top 3 reasons for experiencing homelessness in Peterborough is a family breakdown, unsafe housing, or addictions or some sort of substance use. And so far in 2021, 126 people have exited homelessness and moved into housing. Every month in our division, we come up with the report card. So these are our stats for May. And 8 people became chronically homeless. It doesn't sound like a great stat, but actually this is the lowest number we've seen in 9 months. And the other stat there, 0 people lost their housing, is huge because one of the struggles is not always getting people housing, although in Peterborough we're facing the same situation about the housing crisis and not having enough units. But when we can have a month where nobody is re-entering, going from homelessness to housed and back to homelessness, that's a huge success for us. Also in Peterborough, we have the 10-year housing and homelessness plan. So this plan was developed in 2014. It was reviewed again in 2019. And the goal is to end long-term homelessness and ensure that all residents in our communities have quality housing that they can afford. So the plan is quite extensive, and you can read it on the City of Peterborough website. But the goals of the plan are centered around 2 priorities: ending homelessness and staying housed and building more housing. So some of the highlights from the plan are that on average, 277 people per month were experiencing homelessness in 2020. But there was a 22% decrease in homelessness in 2020 as well. So there's some positives there. And 450 individuals shifted from homelessness to housing. And 38% of these shifts were from chronic homelessness. So 38% of those who got housing were actually homeless for 6 months or more out of a 12-month period. As far as the building housing, that's also part of the plan, building more units. Peterborough City and County by 2029 have figured out that we need 580 rent geared to income supportive housing units and 2,680 new rental units. And so far in 2019-2020, we have developed 26 new supportive housing units and 46 affordable rental units. And so this report is extensive, and it gets reviewed every year. COVID obviously has impacted how well we're doing, I guess. I mean, development had slowed down, so that has an impact, but that is all captured in the report if anybody's interested. And then what I'm really here to talk about is the Beaver Mead project. So through a partnership with Orca and the city of Peterborough, we were able to create what I call the Beaver Mead Project. I don't really know if there's an official name to it, but that's what I've been calling it. So we recognized the need for shelter for those who could not or would not stay in the standard shelter for lots of reasons, a lot that Sandra captured in hers. So if they have pets, if they're a couple that want to stay together, if they've had bad experiences within the shelter, if they don't feel safe, lots of reasons. And what was happening is we were coming across people camping on the outskirts of town. So then that was even a bigger struggle because they weren't making their appointments, they weren't accessing food. It became harder and harder for me as an outreach worker to even find where people were staying. So we were able to make this partnership, and we were able to get 6 sites at Beavermead Park. And I believe it was at a reduced cost, but part of that was they would get firewood delivered every day. Everybody got a bag of wood a day. And we would use the shelter portion from their social assistance to help pay for these sites. And we chose the individuals kind of based on their existing situations. They were living outside. There weren't a lot of protection from the elements. They had no access to bathrooms or water. I mean, every situation was different, but it was really about them not feeling part of that shelter community. They just couldn't do it. The biggest thing that Beavermead allowed was safety, and it allowed the community supports to come in and see these clients on a regular basis, which was huge because our clients are typically transient. If they were camping somewhere, somebody came along and maybe destroyed their tent or asked them to move on, we didn't know where they were going. They don't have telephones. They weren't calling us to say, I've now set up tents here. So we were losing people. So that was part of one of the things that I think made this a success. So it provided shelter and access to bathrooms and showers, and a community that started to feel like their own. And that was huge. Even though they knew it was temporary, they were part of something. They were camping together. The 6 sites were together. They were engaging with Beavermead staff, and it really started to feel good for them. They were building relationships, and we know from training that relationships are the core for anyone living in poverty. If anybody's ever questioned why would somebody have a dog when they can't afford to feed themselves, that is because relationships are so very important when you live in poverty. So we had about 20 plus folks throughout the summer staying on those sites at Beavermead. And we were able to house 7 individuals and couples directly from the tents. And 2 of them actually got jobs directly from the tents. And part of that was we could wrap around those supports. We knew where they were. We could visit them on a daily basis. They had access to showers, so they could show up to get the job in clean clothes after showering. That was a huge thing for them. So all of those basic human needs were being met. And that was truly, I have to give a shout out to the staff at Beavermead as well. They were a huge part to this. All of those things that mattered. We had community partners coming in, including a nurse from the hospital. So we had a client who needed weekly injections, and when she was living wherever in the woods somewhere, she was missing those appointments, and it was really important to stabilize her mental health. Once she got to Beavermead, that nurse would come home at the end of her shift, or come to the campground at the end of her shift to give her that injection. Changed her whole trajectory after that because she was getting her medication on a regular basis. So back to the amazing staff. This would not have been a success without them. I know at the beginning they were really unsure, to say the least, but being able to offer them some training, I think, went a long way. And we were able to give them training in harm reduction, some mental health 101, and just truly understanding homelessness and how people end up homeless, really. And even when I go back, so this project happened in 2017. Even when I go back to, because I'll hear of somebody camping somewhere around the property, staff are still asking for updates on certain clients that were staying with them 3 or 4 years ago. So I want to end with a good news story, because this is why I do the work that I do. And we're going to call this guy Johnny. That's not his real name, but Johnny was a veteran from the UK. He fought on the front lines in Afghanistan. He met a nice Canadian girl. They got married, came to Canada. They had a son together. He really believed that he suffered from PTSD, but was never actually diagnosed. He was truly one of those proud men. He didn't need doctors. He didn't need other people. He could do it all on his own. But what this did was led to a really unhealthy relationship, and he ended up leaving. He left. He got a room in one of our rooming houses, and he was attacked one night with a chainsaw, actually. He ended up pushing the guy down, so he didn't get physically hurt. But again, that leads to the trauma. So he didn't want to go back to that rooming house because he didn't know what was happening with this other person that was living there, if he was going to stay in jail, and he didn't, and he knew where he lived, obviously, because it was the same address. So he left. He went to the shelters and really did not do well in the shelters with the amount of people in the dorm style. He didn't feel safe. He was very anxious all the time. And more he started to stay on park benches. Then somebody gave him a tent, and he started setting up in random places. The piece to this that was really hard for me was that he didn't want his son to know he was homeless. So he would meet his son at the mall every Saturday, buy him a Happy Meal, buy him Tim Hortons. He saved money specifically to do that, and he wasn't getting much money to feed himself, but he was such a proud man that he didn't ever want his son to know that he was living outside, that he was living in a shelter or anything like that. So he was one of the first campers in the Beaver Meat Project. He could have been the actual first one, and he was just a great guy. He was a wonderful conversationalist. He had tons of stories. He presented well. So I couldn't figure out what it was that he wasn't getting the housing, because he was going on viewings, and when I would say how did the viewing go, he would say, oh, it's not for me, or it didn't go well, or I don't think they liked me. There was always reasons for it. So I asked if I could tag along. We found a great little basement apartment. He could afford it. The owners had 14 other people come before him, but he got talking about cars. The owners had an old car, and Johnny got talking about old cars with the owner, and they loved him. They wanted him. They said, here you go, fill out the application. And it was at that point that I noticed that he started to get really anxious, and he's like, okay, I just need to talk about this, so we'll go away. And so we went out in the driveway, and I'm like, what's going on here? What are you doing? And he's like, well, I just think we should talk about it first. And so I recognized that he was very anxious about this process. So we went to Tim Hortons and sat, and it turns out he was not illiterate. He was a very smart man, but he really had troubles filling out applications, and I'd never even thought of this, and I'd never heard of this before. But sometimes when you see all of the boxes and the letters and the signature spots and the date goes here, it can be very overwhelming, and the way you process it is overwhelming. And that's what seemed to be happening with him. And I realized that any of the paperwork that we had done, I was just asking him questions and filling it out. And he had said that. He said to me, even from a young age, he really struggled. It looked very jumbled to him on the page. So we ended up doing some referrals, or even about getting his eyes tested, things like that. Anyways, very proud man. That was a big step for him to even admit that to me. And we filled out the application, and we took it back the same day, and they offered him the unit that very day. And so we were nearing the end of the season. So I think he moved in on October 1st or something into this place. I can tell you he's still there today. I went back to visit him. I did regular visits, but that December I stopped in to see him, and it truly was one of those moments where it's like, that's why I do this, because it was a Christmas tree and he had presents with his son's name on it, and he was having his son for Christmas dinner for the first time by himself. And he couldn't thank me enough, but I thought about this, and It really wasn't about what I did. It was truly about building a relationship and earning somebody's trust and being lucky enough to go on that journey with them. And I see him now shopping, and you know, he no longer needs me as a support, but he's doing really well, and he's maintained that housing, and now he's doing some work for the owners to make some extra money, and he's loving it. So I think the Beavermead project was a huge success, and truly the staff there were amazing. And there was a young guy there, I can't remember his name, but he really went out of his way to talk to our campers, and so they would consider him a friend just because he took time to get to know them. I think he was honestly the kid that delivered the wood, but they would always refer to him as their friend just because he took time to stop and talk to them when they're so used to people passing them by. So I need to thank the staff at Beavermead and this partnership, because to me it was a great success. That's, oops, I just went too far. And that's all I got, everyone.
Okay. Thank you so much, Bill. That's a beautiful story, and I really appreciate you shedding some light on some of the training that you did provide park staff, and you know, kind of their perspective and what that meant for them, seeing this happen, this quite innovative solution to a challenge. So thank you very much for participating and for sharing your stories.
Thank you.
I do apologize, just in the interest of time. I think we're going to take questions for Bill at the end of the webinar. If you could put them in the chat, we'll ensure that those reach Bill. But we're just going to keep things moving. Oh, is that a grandkid? Oh, okay,
that is my granddaughter, yes.
Okay.
It's a highlight of my life.
Yeah, what a button. Oh. Yeah, thank you again. So again, we'll take questions at the end for Bill. So next, I want to extend a special welcome to Matt Hammond, who is the Supervisor of Operations with Park Services in the Regional District of Central Okanagan. And also with him today, we have Wayne, who is the Manager of Park Planning and Capital Projects. But I think Matt's going to be speaking, so I will hand it off to Matt. And thank you very much.
Perfect. Good day, everyone. Nice to officially meet you, and thank you for the warm welcome. It's fantastic to be a part of this whole workshop, all 3 sessions. A lot of information gathered and learned, so thank you very much. I am just going to share my screen right now.
Oh, I think Bill, oh, never mind, it worked.
It's through here?
Yeah.
Okay, so we are the Regional District of Central Okanagan here in Kelowna, BC. My name is Matt Hammond. I am the Supervisor of Park Operations. So generally speaking, maintenance most likely is at the forefront of my job duties there within the parks. But a big part of my responsibilities is also our regulation bylaws. And so obviously that's the bylaws within our jurisdiction, which is specifically our parks. So just to give you a little bit of a background of our location, if you haven't been out to Kelowna, we generally are made up of 4 cities: Lake Country in the north, Kelowna being in the center, West Kelowna, west across the lake there of Lake Okanagan, and heading southwest into Peachland. We also are made up of 2 electoral areas, one being on the east and one being on the west. So generally speaking, for our parks, we have 30 regional parks and then 20 community parks in both of those electoral areas as well. As a bit of a background here, I've just looked up some stats for you all. Generally speaking, 2016, 18, and 20, every 2 years is the stats that are gathered. So we've gathered these stats from the Central Okanagan Foundation here. Just general numbers, experiencing homelessness has had an increase, as you can see, year upon year there. A big jump from 2016 to 2018 with a 23% increase, and then a bit of a smaller jump into 2020. And I have noted this is prior to COVID. So it's important to remember that there has been a jump onwards from there. Average days spent homeless for the community members. Once again, a large increase from 2016 to 2018 of 25%. And I think that goes hand in hand with the numbers of experiencing homelessness there, with a smaller jump of 11% increase into 2020. Generally speaking, our medium home prices here have jumped quite a lot, similar to Ontario as well. 2016, we're looking at $550 up to $710 in 2020. Currently, we're looking about $875, so $875,000 for a general home, single detached that is. A townhome is $620 and a condo apartment is $427. So still pretty much expensive housing. And that obviously goes hand in hand with rental costs as well. Rentals are generally speaking around $1,200 a month for a one-bedroom unit there. If you're in a shared accommodation, being one room being shared, you're looking at paying $800 to $900 a month, and potentially plus utilities on top of that. 5 reasons for housing loss, generally speaking, in the Okanagan here is conflict between the household, illness or medication conditions, conflict within the landlord or the homeowner, and lack of income with substance abuse as well. So who are we exactly? The RDCO Park Services, we're made up of 4 groups of people basically. Our department holds the park and resource operations, which is myself supervising that area. Wayne, who is my colleague also on the chat today, who may jump in a bit later, is covering the capital projects, the parks planning, facilities, and land acquisition. We have a team out of what we call the Eco Centre, which is the Environment Educational Centre for the Okanagan. Generally speaking, they're looking at providing information, resources, working with those communities, whether they're volunteer groups or just local school groups who want to partake within our parks. And then also our parks administration, who are home base. They are the ones that hold us all together and help communication across the board. It's important to note there is one key difference between the parks over in Ontario and the regional district parks, whether it's Central Okanagan or the others in British Columbia. And that's generally we don't have an overall community managing our say bylaws and our services. Each regional district represents their own capabilities and compliance. So we create our own bylaws for our own regional district. So it's important to understand that there are sometimes confusion and differences between one regional district to the next regarding those rules and regulations. So within the park operations, we have split into 3 zones here. We have the north, central, and west. Because we're covering all of those areas of the 4 cities and the 2 electoral, it's very difficult to have the same staff members reach all areas. So we're split into 3 zones there. We have 23 park operators. That is just in the summer months, and that is including our students as well, which are on for only a 16-week period. So when we're referring to our bylaw enforcement officers and park rangers who are qualified bylaw enforcement officers level 1 in BC, that means we have 3 park rangers who are also the team leads, leading the overall management and supervision of those 23 park operators. So their job role is split between the maintenance and management of the operations, as well as dealing with situations such as homelessness. And then at the same time, we've got 1 dedicated park ranger for all 3 zones. And then the supervisor of park operations, myself, overseeing and leading the management of that, providing direction and obviously working with the other areas of the park services team. And so overall, we have 1 park ranger and 3 other park rangers split duties covering around 2,000 hectares of parklands. And our parkland is multi-use trails. We have hiking, biking, walking, obviously, and some horseback riding in there as well. So for resources, generally speaking, internal resources are park rangers. So as I've mentioned, we are a little limited in terms of who we can rely on and dedicate our staff efforts towards homelessness or other issues that we may face within our parks. And then what we've tried to do internally within our organization of the regional district is work with our dog control. So our dog control bylaws have a larger area of jurisdiction. They are also outside the park boundaries, whereas the park ranger's jurisdiction is within the park boundaries. But a lot of cases we have dogs off leash issues, being repeat offenders or leading to more serious cases of issues there. So we have opened up our relations a lot more in the frequent years with the dog control bylaws team, who assist us with park patrols, joining our park rangers, and generally speaking, being a backup team member when we're going into more high-risk situations. Our external resources and partnerships, number one is generally the RCMP. So the police department do assist us whenever we have a call out. If we are limited in our numbers, we will rely on them to join us as backup. Or if the situation has gone into more severe cases, we will step back and ask them to deal with that situation. And this simply comes down to training and experience within what is entailed within that call out. We've also got listed 2 here, and I do have to thank the last workshop meeting, because you have helped put us on this track for Built for Zero, situated in Kelowna, and then Journey Home Society based in Kelowna as well. These are 2 outreach programs here. They generally have task force. They work with providing mental health, access to health support and treatment altogether, provide clothing, water, food and shelter. Overall, they have a fantastic outlook and are more than happy to work with us as well. So we have reached out to them in terms of communicating with us and generally working with us as well. City of Kelowna provide temporary outdoor sheltering. April 2021, we've recently been advertised in the local news and the media here that they're providing more temporary outdoor sheltering. So this definitely helps us with what we can actually provide to the homeless that we find within our parks. And also a needle tracker app has been very popular in recent years as well, which works with city parks, our bylaw services with City of Kelowna, as well as local fire departments as well. From our stats from the last 2 years, we've kind of gathered together here, and I've just put these between January and May so we can relate it to recent stats of this year. So as you can see here in the green, 2020 we had 9% of homeless, and 2021 10%. This just measures off a general percentage with homelessness against our other call-outs of what we face going into fire risk, smoking within parks, safety and alcohol, parking infractions, people parking within the parks on park conservation land where they shouldn't, or going into closed areas of what is restricted closed for their health and safety, as well as damage and litter. And then, of course, dogs and dogs off leash being a bit of an issue, a climbing issue, hovering close to that 20%. So the majority of our incidents are logged on file, but not all of them. Unfortunately, with our resources that we have, we cannot log them all. Just as numbers, it's important to note here that even though homelessness has around that 10% mark of our call outs of what we deal with, the numbers in 2020 between January and May was about 44 incidents. And then in this year of 2021 is 81 incidents. So though the percentage of our call outs remain about 10% towards homeless related issues, it's important to know that the number of incidents have actually doubled from last year to this year. And we expect it's around about a $10,000 a year direct cost directly dealing with homeless issues. This is just a direct initial staffing only cost. There's a lot of other secondary cleanup and fuel costs associated to that on top of it. When we look into the numbers a bit clearer here in comparison from 2020 to 2021, as you can see here, the green marks 2020 and the purple 2021. We've had warmer temperatures this year, definitely earlier on in the season than other years in the past, including 2020. Usually we have a cold spurt of temperature in February, March, and then starts to warm up in April. So our numbers generally don't increase until May time, being the peak time of the summer. This year, we didn't have as much snowfall and we had warmer temperatures, meaning there was more people in our parks, including homeless incidents. So those February numbers, March, April, and May have started to rise a lot more. So a couple of examples of what we deal with our experiences of homeless and what they actually entail. Some of our parks, as you can see, are right on the main trails here. So we do experience homeless sleeping in very public areas, as well as mental health and addictions being a cause of concern for public safety. And then obviously you have the other end of the spectrum where they're in the backcountry of the park, including fire risks being a large concern, dealing with propane canisters or just having open flame fires as well. Food waste attractants and non-biodegradable litter. 2 litter options here, as you can see from the photos there. A lot of brush is obviously gathered around it. So again, fire is a concern, as you can see. But we also have animal attractants being a little bit of a concern there. So biodegradable waste, sure, it will go in the long run, but in the short term, we have had an increased amount of bears and wildlife call-outs, especially in the spring of 2021 this year. And then leading on to syringes and sharps, we do have sharp boxes and containers that are input into a lot of our wash houses, which we do collect on a daily basis. We have had to increase these over the last couple of years as the quantity does increase with that as well. And we've also had bike theft relating to homeless issues as well. So a number of bikes have been identified as being stolen. We have greenway trails within our local community, so access for the general public is up and down these trail sections. Whether the bikes have been padlocked to a post or just put aside whilst they run into the washroom, they do go missing and reports come in. So we do have bike theft from homeless use as well. So when we're called out to an event or a report, what is generally involved? And I've tried to link some basic description here to give a clear indication of how we generally respond to a call out. Prior to actually attending the scene, we may be nearby, but first of all, it's our priority to make sure the location is within our jurisdiction, and that needs to be in our park property. So we utilize GIS mapping for that. We make sure we have a safe entrance and exit strategy before we actually communicate. Obviously, safety risk is performed, and this is gathered from a visual inspection, listening, hearing for sound. Maybe we can report how many people there are, and there has been previous reports of gunshots or not. And then whoever's provided the reporting information is very important, as they can give a clear indication of potential risk level of what is involved. Then the officer will communicate to co-workers and generally speaking, speak to those co-workers there, making sure that there is contact available, whether they're working alone or with a secondary worker. So cell or radio contact as required is perfect. PPE is obviously worn as well to provide to the staff with a first aid kit on site, whether it's in their truck, their backpack or nearby. And this is also not just only to adhere by work safe practices, but to ensure staff safety as well. Then the staff member will approach the scene generally in a calm way, and it's always with an educational focus. We don't want to go in there heavy-handed by any means. We generally call out with, is anybody home? Hello. park operator approaching. We want to make sure we're not startling people, whether they can see us or not. A lot of time, homeless may be within a tent, being enclosed from the outside, and they may not be so coherent if they're under the influence of drugs or alcohol as well. It's very important to understand the situation can change at any moment, and every situation is very different. We have all spectrums from someone who is calm, understanding, and is happy to comply with the circumstance and basically do what they've been asked to do, all the way to the opposite, where we have severe encounters with people with weapons, whether they're knives, machetes, or firearms as well. Generally speaking, if any hostile or threatened, if we're threatened with an approach from that homelessness, then we'll leave instantly. No communication is further performed with that individual or group of individuals, and we call the RCMP for assistance. This is just simply out of our training element, and we need to pass it over to them to deal with more circumstances there. After the situation has been dealt with, we generally do a cleanup and disposal of garbage and obviously the dangerous materials that may entail in that area as well, similar to propane canisters. We provide the administration reporting and file the logging, and that's where we can gather stats and hopefully use those stats towards further funding and work together in terms of reporting these ideas of what we've witnessed and how the circumstances came about. If we can prevent any of these circumstances from happening with brainstorming these ideas in the future, and then obviously further site remediation as required. So this is cleanup of the site, whether brush has been damaged, conservation of parkland as well. These homeless issues on average can take anywhere from 20 minutes to 2 hours of time. Some required repeated visits leading up to 10 plus hours. And we even have some locations where we need to bring in potentially helicopter access, dropping large containers to clean up those materials and fly those materials out. Some of these camps have started as small 1 or 2 tents with odd non-biodegradable materials, and over the years have grown into a large amount where we simply cannot carry them out. We usually have 1 to 2 bylaw enforcement officers on site at a time. So some of our challenges and solutions, as you, I'm sure, are facing yourself, resources. A lot of the time it can be financial or time related. So for us, some of our financial resources have been redirected. Since COVID, we've had to redirect them towards portable toilets, increased janitorial supplies, and increased PPE for our staff there. And then time and availability. Like I say, there's 1 person dedicated as a park ranger with 3 others who are job sharing that role. So we are always working towards that priority item of risk assessment there. Forward thinking, business card support. Business cards basically made up of the references of local groups there that I've mentioned earlier on. Just their contact information. The advocate groups, aids for shelters and addiction counseling. If we can provide just that business card over to that individual, that group of individuals, and spend, rather than 10 minutes, an extra 20 or 30, then we can hopefully provide a long-term fix rather than a short-term Band-Aid solution. And this is something that we're trying to improve upon ourselves. By spending that time with that person, we're not going to be revisiting them the next day after they move camp to another location within the park. We want to make sure that we have an easy direct contact with them. Our general goals and objectives for the future is obviously working with more groups, volunteer groups, advocacy groups there, wherever available. And through these workshops, we are finding a lot more of them. It's been fantastic, honestly. It's been absolutely great to kind of create good relationships with these groups. Since, like I mentioned, the resources are limited in some areas of our parks, then these groups are able to be semi-qualified, at least have a better understanding of how to deal with the homeless situations, whether it's mental health or abuse in the past, rather than our specific park ranger training that we hold ourselves. We could provide water and small pack of snacks to them, small pack of cookies possibly. a big reason of looking into this is to actually allow the personal group of people to sober up and actually understand what we're asking of them. There's been a few cases where we've reached out to them to ask them simple questions of their situation, whether it's living struggles, if they've been to a camp or understand these resources are available to them, and they're just simply unable to respond because of drugs and alcohol. So by providing a little bit of water, snacks, they're able to sober up and actually understand what we're asking of them in the first place. For our parks bylaw policies, we need to update and obviously continue with those updates. And by joining these workshops, like I mentioned before, is super important to us. We also work with our other regional districts, Metro Vancouver, or Capital on Victoria, on Vancouver Island, who can have similar situations, generally speaking, in warmer weather climates where homelessness is a higher issue for those populations. And then obviously attending these workshops and information sessions across North America. And that's all I have for you. I'll leave it open to questions if we have time. Thank you very much.
Thank you very much, Matt. I think it's interesting to see all of the parallels that you draw from province to province. There are so many relatable pieces that I think your perspective is extremely appreciated. So thank you very much for joining us, and I hope that this relationship can continue for further workshops in the future. Absolutely.
Thank you very much.
I think we will take questions at the end for Matt and for Wayne, same as we've done for Bill, unless you want to put it in the chat. And of course, you can correspond with each other in the chat, as Bill's been doing with our participants. So if we do tend to run over 3 o'clock today, hopefully you can stay with us for some questions at the very end. But right now, I would like to introduce you to Angela McKenna, who is the owner of Capstone Development and Training, and likely not an unfamiliar face to many with us here today. So welcome, Angela, and I'll hand it over to you.
Oh, thanks very much. Yeah, lots of really great information, and it's really interesting to just see this evolve over the years, and so certainly really cool stuff that's happening. So thanks to everyone that has come today and just shared their experience. I think it's really, really valuable. So thank you so much. I'm just going to pull up, I'm going to try to pull up my PowerPoint. I'm not as familiar with Teams, so you know, Tori's been kind enough to give me some lessons here. So hopefully you can see that. Everyone can see that okay?
Looks good.
Okay, perfect. So I'm coming at this a little bit different than some of the other folks that you've heard from so far, but actually I think it all really kind of comes together nicely and supports each other very nicely, actually, and it's kind of a bit of a closing of the loop here. So those of you that know me know my background is in policing, and I worked for Waterloo Regional Police for 15 years, so that's in the Kitchener, Cambridge, Waterloo area. And so certainly have lots of experience with conflict management, and that's sort of the angle that I want to just bring forward today into this issue as well. And so this is just a quick recap of some of the things that we're going to talk about. So I just want to remind the conservation staff too about the client-centric mindset and model. And we did some of this training through Conservation Ontario, you might remember, back, I think it was the spring of 2019. And so I'll just give you a quick recap about what that was. And then I also want to just introduce the concept of something called trauma and violence informed practices, or it might be called an approach, or there's some different verbiage out there, but that might be something that's new to you, but I think you might find it interesting given what you've just heard from some of the other speakers. And then I want to jump in and talk just briefly about some de-escalation and communication skills that could work for you in the field. We'll talk about a quick little communication plan, and then we'll talk about a scenario. It's a very sort of a stereotypical kind of scenario, but I think it'll help us kind of think about things more from a big picture perspective as well, given what we've been talking about today as well. So if you remember the training back in 2019, there was this push to just kind of refresh a concept that's been around with conservation, I think maybe since about 10 years, maybe a little bit more. The client-centric approach starts to look at people accessing services through conservation authorities as clients or customers. And it goes beyond customer service, and it really starts to look at people as if they're accessing your services. What would that be like as a client who's coming to interact with you? And so you're starting to look at people and trying to create the best solution for the customer in order to meet the needs that they might have. And so I think that this is a really interesting approach given what our topic is today, and it'll tie in with the next couple of slides as well, and hopefully start to create some links here for you. So really what we're trying to do is think about our customer experience when they're interacting either maybe with a service that you provide. This could be frontline staff, someone accessing CA land just in a day use type of situation. And so what is it like as a customer to interact with the staff and or services being provided by a CA? And we should have a solution development or problem solving orientation in our mind when we're interacting with people. The other thing this approach really rewards staff that have a deep insight to our customers. So if you think of a traditional model is more based on, how many files did you complete or how many numbers of whatever. It's sort of number oriented. But when we look through this approach, it actually starts to reward staff in a very different way. And, I wonder if maybe social services kind of have a better approach here than certainly policing has in the past. And it starts to reward people that have the ability to build those deep sort of rapport-based relationships and starts to show value in those types of employees. The other thing it does is approach problems or approach interactions with clients from an integrated approach. And so traditionally businesses are set up very siloed, meaning, the left arm doesn't know what the right arm is doing. And so they have this siloed approach. And we want to move away from that and move into an integrated approach. And really all of the people that are speaking to you today represent that really well. In the case studies, for example, I think it was Sandra that was our first speaker, and I apologize if I have your name wrong. But that approach where we're tapping into a bunch of different agencies and resources in order to look at a full solution to a problem rather than just one facet, that's a really great example of an integrated approach. And certainly it sounds like the other two cities involved are doing much the same idea, and that's where we see success. Okay, and so this client-centric approach is really important for us to be successful long-term. The other concept I want to bring forward is this idea of being trauma and violence informed, and that could be language that you've heard before. It's starting to sort of come out a little bit more in lots of different industries. It's actually originally my understanding is that it's originally from the medical field in relation to how medical staff are interacting with people coming in for care. And so I've been working the last 2 years with Western University in London with a group that is piloting a project with the London Police about becoming a trauma and violence informed organization. And so I just really felt that this was a piece, it was sort of nagging at me that I felt like I needed to bring this forward and let you know about this approach, because I just think it's really valuable. So this idea that we can sort of see things from a different perspective than your own. And so looking, it's pulling at that empathetic piece in you to look at the other person with just a little bit of a different lens. And the lens we want to use is to make the assumption that trauma is a factor in our behavior and our response to situations. Okay, and so some of the other speakers really did a wonderful job to discuss how many of the people experiencing homelessness, it's not a simple situation, and it's so complex that there's lots of factors at play here, and a lot of those factors are based in trauma, and so they've had lots of frankly horrific experiences, and so it makes interactions based out of trauma. And so if we can assume that everyone that we're interacting with has had some kind of trauma in their life, it can change the lens with which we respond to that person with, okay? So that's kind of the concept involved here. And so trauma and violence is really broad, and it can include a lot of different things. So this can be a physical trauma of some kind. It can also be mental, of course. This can be done to you by your employer, by society, and certainly we see time and time again groups such as Indigenous populations where this is happening over and over and over. And so we need to be mindful that all of those things are what we were talking about when we talk about trauma, that it's not just, you know, sometimes we think of trauma as one really particularly violent event or something like that, or a highly emotional event. It's not. It can be little things over time, and this is certainly what's coming out when we talk about post-traumatic stress, for example, and things like that. So there's some pillars involved here. This is the idea of being aware, recognize that trauma is prevalent. In fact, all of us have some trauma that we've experienced at some point in our life, and this is the basis of this approach, is to make that assumption and respond along with the person under that assumption. Okay. The other piece is recognition, recognizing that someone's behavior could be connected to their trauma response. And what I mean by that is we innately as humans have this fight or flight or freeze type of response that's built into us, you know, biologically for survival. And so trauma can tap us into that. And so sometimes those of us that are interacting with people, we're actually interacting with their trauma response. And so it's really important for us to keep that in our mind, in particular when we're dealing with people experiencing homelessness, because certainly they're already in a situation that is putting them at that sort of higher trauma response, because as others have said, they're in that survival mode, and they have to be because of their situation. And so we just have to recognize that as part of our response. The other piece is engagement. We want to try to avoid re-traumatizing a person and make sure that we're offering support. Okay, and of course, certainly many of the other speakers have really done a good job telling us how we can do this. So we want to look at making sure that we are a place of safety and trust. And so that means we can do this by having that calm, open, approachable demeanor. And we want to make sure that we're not escalating the situation or making someone feel like they can't trust us, okay? And so certainly people may have, that could be part of their trauma response, is that they have repeatedly been someone has taken advantage of them, or you know, taken advantage of their vulnerable state, and so therefore they could be feeling very distrustful, especially of authority type of figures. Okay, and so we want to keep all of these things in the back of our mind and almost do more work to ensure that we're coming across as calm, open, approachable, and all of those things. Choice and voice, what this means is providing information so that the people that we're working with can make decisions. And I really love what I heard from some of the other speakers about, you know, if we know where the person experiencing homelessness is, then it sort of creates a stable support system around them, because you know where to go to get a hold of them, and you can start to work with them. And I really love that. And it's being able to provide that information so that they can tap into the supports and tap into decisions that need to be made for their own welfare, and to help leverage themselves out of this situation alongside some supports. So they can choose what happens to them. We want to make sure that we're asking for their opinions and not placing on them what we want to do for them. And this is really sometimes difficult. We need to be able to step back and allow people to have choice and voice. Strength and resilience. The other thing that's really important with this approach is that we step back and we recognize that people have survived past trauma and developed resilience from that, and validate them for that. And so I have the word respect written here. And I think it's really important to recognize that we just need to kind of show up and recognize that they've been through a significant amount. They're in a particular place that they don't want to be. And, you know, hopefully we can be a mechanism to change that situation for them, and to recognize that they have come so far and that this is just a temporary place that they happen to be sitting. Okay, so we want to make sure that we're approaching them in a respectful manner. So hopefully that information is starting to sort of resonate alongside some of the information that you've heard from the others today as well. So quick definition here, conflict obviously can be a lot of different things. You can think of this as a spectrum, you know, all the way from, you know, just a disagreement between a couple of people. We have a difference of opinion, and this can really go all the way up to the other scale of things where it's a physical altercation. Okay, and so conflict can mean a lot of different things, but generally we're looking for a peaceful resolution through some kind of a negotiation where we can agree on things, and hopefully that relationship remains intact. The biggest piece here is to remember that if we're going to manage conflict really well, we need to hone our communication skills. And communication means body language, the tone in which you're saying things, and also the words that we're choosing. So we want to make sure that we're choosing words that are respectful, that are not connotation driven. And then we want to be really mindful of the way in which we're saying that. And then we want to make sure that our body language is communicating the same message alongside what we're saying. The challenge that many of you might face is that you are a little bit unique in the sense that you have some form of authority or a decision-making power. And this is what can sometimes create more conflict than what you intend. And so sometimes people don't respond well to authority figures, and it's really that simple. And so you're already sort of got a wall in front of you, and you really have to overcome that. And in my experience, when I was a police officer, certainly when engaging with people that are experiencing homelessness, I really found that this was true, that often there's been a mistreatment in the past, and I was a representation of that, and it's definitely linked to a traumatic experience for them. And so there was things that we had to do to overcome that right away, even though it wasn't me personally. And so you could represent that to someone as well, and it's just really important to keep that in mind. Okay, and so again, sometimes that just means you have to do a little bit of extra work when it comes to the communication side of things. Something I want to just draw to your attention, again, you may or may not be aware of this. There is a document referred to as the Regulator's Code of Practice, and this comes from the Ministry of Labour in conjunction with a bunch of other ministries in Ontario. And it's a document that was put together to really start to outline sort of like operating principles, if you want to call it that, for members of the Ontario government, so any employee. So for example, I teach this document to firefighters as well, and specifically fire prevention officers that are doing inspections and things like that. They're operating under the exact same 4 pillars that you're seeing here on the screen. So this document outlines organizational values, elements of professionalism, regulatory best practices. But the one I want to focus our attention down into is the yellow one in the bottom, the customer service principles. And they set out these 5 basic principles, which I'm showing you here as a graphic. And this can really be thought of as a communication plan, and it's a nice little breakdown for us to use kind of out in the field when we are engaging with people. And really, when we're cycling through this, we're keeping this idea of being trauma and violence informed in the back of this, but this actually supports that as well, because it's sort of just a nice kind of linear layout for us. So of course, when we're working with people in the field, we're going to introduce ourselves and who we are and why we're there, you know, et cetera, et cetera. But the next two phases here, the explain and connect, is where we're doing a lot of the communication work. This is where we're doing the de-escalation stuff. This is where we're doing our conflict management strategies, where we're explaining, you know, maybe it's an enforcement piece that you need to explain, or a reason why you're conducting an inspection. And we're sort of explaining why we're there and what's involved. The connection piece is this idea of connecting into any kind of legislation, statutory authority, or anything like that. And so we're being providing information and being transparent about who we are, why we're there. And in this case, if we're asking someone to leave, we need to make that clear as to why we're asking them to leave. Okay. The inform and conclude portion is really getting into informing them of a complaint process. If you are, you know, review and planning type of staff, then you want to make sure that you're talking to them about an appeals process, for example, for their permission, those kinds of things. Okay, and so if you're going to be following up with them, this is where we're just kind of heading that up, saying you can expect to hear from me again in a couple of weeks, or I'm going to come back and check in on you in 2 days, those kinds of things. Okay, and then of course we would conclude our interaction with the person, and again make sure that they have our contact information. We're going to reiterate, you know, what's happening based on our interaction with them, and certainly lay out that they can expect follow up if that's applicable. Okay, so again, the benefit of this communication plan is that it comes from the Ontario government. It's written down, which means it's something that you can kind of fall back on as quote unquote approved. And it does give you just a nice little thing to follow. So the next piece that I would like to do, I'm just going to stop sharing. Maybe, okay. I'm not sure how to do that. Okay, so what I'd like to do, actually, I just realized it didn't load in the scenario. I'm not sure how to do that from here. Is it still sharing, Tori, my screen?
It's a gray screen, but it looks like you might have to stop, stop presenting all
okay. Yeah, so I can't see where to upload the file. Maybe it's not, but that's fine. I'll just kind of read it out to the group so you know what we're dealing with. And then I'd like to just kind of open the floor up and we can have a little bit of a discussion about how do you think we should deal with this situation? And I think that this is a bit timely considering some of the other presentations that we've heard today. And I'm really interested in people's responses to this, given what we've heard from some of the other presenters. So basically, you're working at your local CA, you're checking property during regular patrols. You've heard from some other colleagues that there's people doing some unauthorized camping at sort of a back portion of the CA land. It's a little bit more remote. And so you've been, you know, just out and about looking to see if any of that's happening. You drive to a particular remote trail, park, and go out on foot, and you can hear people off into the forested area off of the designated trail. And you can see that you think that there might be some tents back in there, so you go back just to check it out. When you get there, you can see there's about 3 tents. There's a blue tarp strung up between the trees, and there's an active fire burning that's causing quite a bit of smoke, and it's right near the tents. You're a little bit worried that might be dangerous. There's about 5 people there. One woman is very jittery. She's scratching her arms and face, walking around incoherently. She seems quite agitated, and she's muttering very angrily to herself. When you try to talk to her, she's just not able to focus on you, and she's very incoherent. Once you get the attention of the other people, you try to say that you're concerned about this particular woman. They start becoming rude towards you, telling you to leave, those kinds of things. One person appears angry, he gets quite loud, his movements are exaggerated and agitated. You're trying to tell them that their activity isn't permitted, and one person starts yelling that they're a free person, they can move across the land how they see fit, and that they don't recognize your government position and you have no right to remove them. He stands there with his arms crossed and plants his feet on the ground. And as you look around, you can see some syringes on the ground near the tent where the incoherent woman came from. You become concerned she may have recently used drugs, and you're concerned for her well-being. And the original gentleman starts yelling at you, "Oh, so now we're all druggies, is that it?" And he comes close to you and sort of getting in your face. So let's talk about this situation. So I'm just curious, I'd like to put it out to the group. What are some of the things that we're thinking about, and what do you think you could do as a potential reaction to this situation? So we can do this a couple ways. We can use the chat function, or you can certainly unmute and add your voice to the meeting.
Actually, yeah, if you could raise your hand, use the raise hand feature if you'd like to say something, or put it in the chat and we can read it out, but we'll use the raise hand and we'll call on you to speak.
I feel like the Jeopardy music needs to be playing right now.
Oh, Lisa?
So the first thing is you need to be well aware of your surroundings, and your safety comes first. So you may need to, as things escalate, get out of there and come back with support.
Yeah, wonderful. Yeah, thanks for that, Lisa. Yeah, and I like that you're thinking safety first. Always my message when we're talking about de-escalation situations is always your safety first. Yeah.
Thanks, Lisa. John?
Yeah, sure. I'll follow that up after we address our own individual safety. Reaching out to our partners to figure out how to coordinate that response is often something we need to think about. Certainly in our parks, we might not be the first to have engaged with these individuals, and there might be others who are better served to help address these issues. So when we see some of these things happening, I think from our perspective, we always try to give our local bylaw a call, give our local police detachment a call. And often this can happen, maybe not in this scenario, but in others where you can gather that information before approaching the tents or before approaching that site, because a coordinated response is often a good one.
Yeah, exactly. And I think that that's a really great point that's been made today, that if you can have a coordinated response to something set up prior to engagement, I just think that you're more likely to be successful, right? So yeah, awesome. Anybody else?
We have a comment from Mark. He said, I think more preparation would have an order, pin the location on a map, plan a safe exit and entrance, return with first aid kit and PPE.
Yeah, all of that stuff is great. Absolutely. Yeah, and I think that that's something that's been highlighted today as well, is that this is a complex issue or challenge. And so it can represent a wide range of activity that you may come across. And so you do want to be cognizant going in and prepared. And that's a really great point. We'll talk more about that shortly.
Thanks, Mark. Tanya or Tanya?
I'm not hearing anything, sorry.
Or Tanya? I have one hand up from Tanya or Tanya. Might be that your audio is just not coming through clearly. Perhaps you might be able to utilize the chat feature. Sounds like maybe there might be an audio issue.
Yeah, no problem. Yeah, anybody else?
I'm not seeing anything else for the moment.
Perfect. No, that's all really great. And as I said, one of the things that we want to think about right off the hop is, of course, your own safety. And I love that, I think it was Lisa brought this up for us initially. And then, sorry, I think it was John that went next that talked about sort of preparing ahead of that safety plan. And so that's exactly right. Before we start to even engage into a situation, we want to make sure that we've really given thought to that, especially situations like this, again, because they are so complex. And we could be dealing with someone that has a mental health crisis happening for them as well. And so we want to just give thought to that before we kind of go walking in. And so that safety planning is really important. And that means being aware of your environment, ensuring that you do have proper PPE, that maybe you're not going there alone, that maybe you're taking someone with you. And if we can have that coordinated approach with a proper support alongside with us, that's even better. Okay, so if we can gather that important information prior to engaging, that's really, really golden and allows us to deal with the conflict in a much more constructive way. The other thing we need to do is reflect on how the other party may feel or react to your presence. And this is really important. And again, goes back to that trauma piece that I was speaking with. Remember that some people in particular may have a very trauma-oriented response to someone in uniform. And it doesn't really matter what that uniform is. And so we just want to be mindful of that. What we want to do also to prepare ourselves is brainstorm potential responses. So when I go, if this happens, I will do X. And we want to tap into that visualization piece and our own imagination in a way, and use that to our benefit and kind of almost come up with a bit of a game plan in our head. And so that when we do that, we protect ourselves from our own trauma, from a particular, say if there happens to be a violent reaction. But it also just allows us to kind of prepare for an event. And therefore, we're a little bit more likely to be successful during conflict as well.
Can I just
yeah,
Angela? Sorry, yeah. I just Tanya finally got a comment through here. It
sure.
said she's a park ranger, lots of issues here. So her response was to back out to safety and keep an eye all around for others, female, aggressive male. Smoke means call 911.
Yeah.
You need fire police immediately. You need their support before re-engaging as male is agitated.
Yeah, absolutely. And I think this one is a good example of, again, where maybe you get in there and you realize, you know what, this isn't really a place that I should be. And there's absolutely nothing wrong with disengaging in this particular type of situation. And then, you know, letting other people go in and connecting with people, right? Yeah, so good point. Thanks very much for putting that into the chat. So, I'm not sure why things aren't showing up here. There we go. Okay. So some of the communication strategies that come up are, again, that identification of yourself and explain the reason why you're there. Active listening is probably one of the best strategies that we can use no matter who it is that we're engaging with. Okay, and so these are sort of universal approaches no matter who we are dealing with. So active listening looks like eye contact, head nodding, encouraging body language, that open, calm, professional demeanor, okay? Often, what is an effective combination is pairing that while someone is venting. So typically what we can see is if someone's particularly agitated, we can allow them to sort of vent and let off a bit of their steam, and while we actively listen to them. What I have found over the years is during that venting period is when we can often get a glimpse at some of those trauma responses. People will tell you little things in that venting that are actually almost like little signals that, okay, this person doesn't trust me because I'm in a particular uniform, or this person's been hurt before by from another police officer, or whatever. And so they'll often sort of, sometimes they're shouting those things at you, but they will actually give you these little clues, and they're really, really helpful. So I would really encourage you to allow people to vent their frustration to you and just simply listen and take it in. When we do that, we're also validating them to a degree and allowing them to speak, and being permitted to speak is really powerful. And we sometimes take that for granted. When we do choose to speak, we want to ensure that our tone of voice is really calm and that we're giving lots of personal space. In particular, if we're dealing with someone who we suspect might be suffering from some mental health challenges, we want to ensure that they're not feeling re-traumatized or pushed into a corner, and those kinds of things. And personal space is something that's really important to kind of keep in our mind, especially if you deal with someone who might be suffering from hallucinations or suffering from paranoid thought patterns and things like that. Then we just want to be really, really aware of personal space. Okay. Paraphrasing. So if we think about how this could roll out, someone's venting to you, they're agitated, they're upset, we've listened to them, and we're sort of encouraging them to talk. We want to then paraphrase or reflect back to them and say, you know, I think I'm hearing that you're feeling this way, or I'm hearing this is your concern, and those kinds of things. When we have that kind of a cycle set up for our communication, it just helps things move forward rather than being stuck just in that venting phase where sort of we're not going anywhere. So it validates again that you've heard what they have said. It also forces you to actually actively listen to the person. Because sometimes what we can do is just kind of let them vent, but we're kind of in la-la land and we're not actually listening. But if we know that we're going to allow venting, we're going to listen, and then my job is to paraphrase back, it forces us to listen to the person. And sometimes we need to be forced. Some days are harder than others to do this well. And so it helps to verify that you're both on the same page. And it helps, again, to have that person feel validated. Remember that this is not a personal attack on you. It is really, it's nothing to do with you. In fact, it could be simply about who you represent. And so for some people, you could be, you know, an arm of the government in their mind, or something like that. And so for them, it's really they're attacking that, and it's not so much you as a person. Okay, and so you want to try to keep the case and the interaction to the facts and any rules that are in place, if in fact that's the road that you're going down. Okay. And know your stance and be able to explain processes behind it. So this is really important, especially if you're going to be asking someone to leave, then you need to sort of have things set up in order to know why you're doing that and be able to explain processes. And of course, today we've heard the importance of ensuring that proper supports are in place as well. Another strategy that I have found particularly helpful is asking questions. And we want to just be careful about how we do this. We don't want it to become an interrogation of people, but asking questions in order to gather good information, right? And so the other thing is, if someone's really upset, asking a question can kind of flip them out of that emotional response and flip them over to a more logical response. They have to process your question, look for the information in their brain, pull the information forward, and choose to respond. And so temporarily even, it's flipping them out of that highly emotional state. Okay, and that's where we want to go as well. The power of saying thank you is really important too. So especially when someone has vented frustration to you, whatever that may be, thanking them for telling you those things is really important. And I think of the gentleman from Peterborough that was talking about, you know, the man that said he couldn't fill out the application, or he felt really stressed about filling out the application. You know, I hazard a guess he probably did this and thanked him for telling him that information, because it took a lot for him to step forward and admit that and be vulnerable in that moment. And so if we don't acknowledge that, we undermine the trust that we're building with that person. And so saying thank you to someone is probably one of the most effective communication strategies that you can do. And we can start practicing this in little ways in our email communications. We can start off an email always with some sort of thank you to the other. Okay, so we can start building in that language. And I really feel that it's probably one of the most effective communication strategies we can do to each other always. The person that you're interacting with should feel right, in the sense that they should feel that they've been validated, they've been heard, they've been listened to, and they should leave, even if they aren't getting their way, they should leave an interaction feeling that they have been heard, validated, etc. Okay, and of course we want to look for those opportunities to compromise, etc. I'm just gonna, sorry, go ahead, Tori.
Angela, we've got about 10 minutes before 3 just to give you a good time.
Sure.
Thank you.
So I was just gonna say, I'm gonna skip to a couple of slides. I'm just gonna skip ahead because we know all this. So de-escalation techniques, some of this stuff you've probably heard before. If you're interacting with someone who's very escalated, it's important to keep yourself calm. It's also really difficult to have an argument with someone who's calm. And so think about taking a deep breath, check in on your own emotions, and really monitor those emotions to keep yourself calm, steady. You want to have that calm tone of voice when you're interacting with someone. Slowing your speech cadence is really helpful, and again, that personal space and active listening. The gentleman in the slide here is demonstrating a non-threatening body posture, so generally known as having your palms open and your hands up. You might not stand exactly like this, but you get the idea. So you don't want to necessarily have your, for example, arms crossed across your chest and have that closed off approach. You want to be open. So some cognitive techniques that we want to think about is being empathetic, and this goes back to that trauma and violence informed approach, and keeping, try to appreciate their perspective and use that universal approach of making the assumption that everyone that you're dealing with has some sort of trauma, and that sometimes our behavior is simply a result of that trauma response. Okay. Allowing silence, of course, avoiding threats, consider apologizing if it's appropriate, asking ideas from them. And in particular, I think this is really, really important when we're dealing with people experiencing homelessness is, as you can see from their own case studies, they're talking over and over and over again about how people look right through them, don't acknowledge really that they're human. And I think it's really important to ensure that when you're interacting with people that are in this situation, that you're ensuring you're representing and helping them to a place that they want to go, in the sense that this is a representation of what they want and not what you want. And so making sure that they're part of that solution development is really, really important in my humble opinion. So we want to set limits, but we have to know when to be flexible as well. And I think both of the case studies that we talked about today really are a good demonstration of that. And I really loved the one where the park staff allowed the person to stay on the property, knowing that that was the best way long term to effectively help this person. And so, yes, there's limits, but they certainly knew how to be flexible and really challenged perhaps their own thinking around this issue. And I think that's really interesting. Slow things down. And so especially if someone's really agitated, we want to just kind of slow things down. Lastly, again, this officer safety stuff, just making a plan prior, know your exits, avoid cornering yourself, and how to get help if you need it. Know when to get out and call for those other resources, whatever they may be, whether it's police, fire, ambulance. In this scenario case, this person could be in medical distress and actually be on the brink of an overdose. And we want to make sure that we're connecting with the right authorities as well. This is just basically a quick picture of an interview stance. And again, this is more enforcement oriented. It's just knowing that you want to not have your hands in your pockets and things like that, particularly if you're dealing with a group of people or someone who's quite escalated, so that you can, defend yourself if you needed to. Giving yourself that time and distance away from people, keep your head up, watch the person, and just assess any cues from the subject to look for those extreme agitation or violence coming from them. This is really pointing toward what we'll discuss on the 23rd, is just a bit of a case study, I guess, that's out of Seattle, and just a plan that they came up with as the city and how they started to deal with what they refer to as unauthorized encampments. And I just thought that it might be beneficial to share. And so this is something that we're going to get into more on the 23rd. So I apologize. I know I threw a lot of stuff at you real fast there. So any questions or concerns, I'm happy to speak to, but I love your approach here with knowing that you might need some help to deal with this issue, knowing it's okay to back away, and getting the right people at the situation and thinking about things ahead of time. Absolutely. That is it. Any questions?
Yeah, we'll open it up to general questions if you want to use the raise hand feature or use the chat. That's open for Angela right now. Oh, will a recording of last week's session be available? Yes, it will be. So if you did register, it is available to you through Teams. If not, contact me directly. I'll put my email in the chat and I can help you out with that. Okay. I think those are old hands up. Okay, I'm not seeing any other questions coming through.
Sounds good.
Okay, well, if there are any additional questions, of course, Angela is going to be back with us again next Wednesday, so we can save them for then. Obviously, as she's mentioned, she'll be more than happy to help you out with any questions facilitated afterwards. So with that, I do want to really thank you so much, Angela, for sharing your time with us today. It's much appreciated, and we all really appreciate your blending the perspectives and the nod to the programs that have been presenting ahead of you as well. So with that, I just want to share my screen here. That's not what I want. That's what I want. Okay, so concluding our second webinar in our three-part series, again, a huge thank you to our presenters for their support and their time on this webinar series. And next Wednesday, we'll be exploring case studies from CLOCA and the Grand River Conservation Authority, looking at CA properties that have been particular hotspots for encampments. We'll dive into site remediation, staff safety, lessons learned, and challenges ahead. Of course, followed by part 2 of our communication and de-escalation training with Angela McKenna. So I would like to say thank you on behalf of the CA workshop and the RCC committee. Thanks for participating, and we'll see you next Wednesday, June 23rd. Stay safe out there, everybody, and thank you.